Namaste. Welcome to our session about the Health of the Nation report of Apollo Hospitals 2026. Cancer is often feared for what it does, but we don't talk about when it begins because in many cases it doesn't start with symptoms, it starts silently. And sometimes it can be found even before it ever speaks. So, from the Apollo Health of the Nation 2026 report, we found that among women screened, 1 in 113 was diagnosed with breast cancer, and nearly 1 in 3 mammograms showed abnormalities that needed further evaluation. Another finding was that Apollo's pap smear screening rate was at least 33 times higher than the national average. This is what happens when cervical screening is integrated into a comprehensive health assessment program rather than offered as a standalone service. Though, when we do a cervical cancer screening, a pap smear, the final abnormality rate may be low. That really means that the yield of this test will be much higher because nationally 60 to 70% of cervical cancers are diagnosed at advanced stages. So there is a definite benefit in screening early and getting that even low yield so that these can be reversed at the earliest, treated before it's too late. So, to help us understand this whole concept, I'm joined by Dr. Sai Lakshmi Daayana from Apollo Hospitals, Jubilee Hills, Hyderabad. Dr. Sai Lakshmi is a senior surgical gynecological oncologist with over 21 years of experience. She specializes in the comprehensive management of ovarian, uterine, cervical, vaginal, and vulval cancers. And her expertise includes advanced minimally invasive and robotic surgeries, including fertility sparing cancer treatments and complex procedures such as staging surgeries and radical hysterectomy. So I can't think of a better person to give us insights about this finding of the Health of the Nation report. Welcome, Doctor, and thank you
Thank
so
you.
much for being here.
Thank
We
you.
often think of cancer as something that shows up with symptoms. This is a common misconception, but we know that it is important to detect cancer even before symptoms begin. So, could you please explain to our audience how that might change outcomes?
Uh, Look, every disease starts with one cell in the body. Yeah, you can't just have a whole organ diseased at one time point. So whatever it is, even a cancer, it starts with one single cell, then it becomes two cells, then it becomes four cells, then it multiplies, and then it becomes 1,000 cells and 1,000,000 cells, when probably you're able to touch it or feel it or sense it. So before any cancerous tumor or cancerous growth or even a blood cancer like liquid cancers, before the cancer starts to affect you in a wrong way, like it causes pain or it causes discomfort or a lump that you can feel, it's always starting with one cell. So most, not most, I can almost say all of the cancers, they do not cause any symptoms when they are beginning to grow in your body. So only when it has grown to a certain size and it is affecting your nerves and your blood vessels and the surrounding structures that you start to know that something is wrong with that part of the body. So if you want to find a cancer before it even starts bothering you, we call it stage 0 or stage 1, it has to be picked up on a test. There is no way a human being will know that there are just a few cells which are not working well in their body. So nobody can pick up with their own intuition a stage 0 or a stage 1 cancer. And we call it a stage 0 when it hasn't even gone past a few cells, which we can pick up on a blood test or a urine test or an ultrasound scan or on a mammogram or even on a pap smear. So stage 0 means where the cancer is just in its infancy and you have by chance picked it up, you remove it. You don't even need to remove the organ. You remove that piece of skin or you remove that tiny bit of milk duct which has grown this stage 0, a baby cancer, and then it's gone. So you're back to your normal self. Stage 0 is where only a very good machine or a very good expert doctor or an expert pathologist is able to pick it up. A human eye will miss it. Stage 0 cervical cancer, even I cannot pick it. It's microscopic. So I'll take a pap smear and my pathologist says, hang on, Sai, there is a stage 0 cancer there. Please call that woman back. So stage 0 is totally test dependent. Stage 0 or even very early stage 1, you can pick that cancer up on a test. You can remove only a selective part of the organ which looks diseased. You can keep the organ as it is, and the person is cured of that cancer. Isn't that fantastic? Isn't it fantastic that you're diagnosed with a cancer, but you don't have one single symptom? You haven't even lost a body part and you're cured of it.
You probably can even get away without extensive chemotherapy or anything like that
To be
sometimes.
honest, Dr. Srinidhi, for stage 0, stage 1 cancers, 99% of the times, limited surgery alone is enough.
Yes.
So if it is a stage 1 cancer or a stage 0 cancer of the breast, we remove like a 1 centimeter piece of the breast and the person is cured of breast cancer. It's that limited surgery. And for these, we don't need extra chemo, extra radiation, and the person will have a normal lifespan ahead.
That's fantastic indeed. And I think the message here then is that screening is important, testing is important. So we don't wait till we have symptoms. So that might be something that is quite advanced. So in our Health of the Nation report 2026, one thing that came up was, as I mentioned, about a large number of mammograms showing abnormalities. For someone hearing that just as it is, just as a statement, it can sound alarming. But does this actually reflect a fact that, we are actually getting better at, or at least more people are coming forward for screening and we are detecting things that can be corrected? Or is it a higher burden of disease?
Actually, Dr. Srinidhi, 80 to 90% of abnormal mammograms are not due to cancer.
Mhm.
Okay, so when we classify a mammogram into normal or abnormal, the abnormal category will also include those abnormalities which don't lead to cancer. So this is what every woman who is going for a test needs to understand. For example, I see people who go for health checkups voluntarily. Nobody's asked them, they've never met a doctor. They just found a package at a discounted price advertised somewhere. So they go and they get this 36, 40-page document with like 60 blood tests on them. And they see some red highlighted marks or whatever, and they panic. They expect perfection from a test. It could be a minor anemia, it could be a small increase in, say, a certain enzyme or something, a liver enzyme. But when they look at that highlighted thing in the report, people panic. It's like, oh my God, there is something wrong with one part of my blood test. They come to us and I ask them one single question: are you perfection on the outside? This morning, when you woke up and looked at yourself in the mirror, do you see a perfection, a perfect person? Or do you see a blemish on your skin, or some gray hair, or a wrinkle here and there, or any part of your body looks slightly imperfect? We are imperfect on the outside, we are imperfect on the inside. How that imperfection matters in your overall health is what's important. So, a minor deviation in your blood report or a minor issue on your mammogram cannot be considered as a serious abnormality. So on mammogram, so many times we report issues with the fatty tissue in the breast, like a lump of fat, a fibroadenoma, fibroadenosis, or a calcification, which might not lead to anything. But a radiologist knows that these are subtle findings which won't lead to cancer. But these subtle findings might be the cause of the lump, might be the cause of pain, or these subtle findings now might lead to something more in future, and we might need to keep a closer eye. So 80 to 90% of abnormal mammograms are just pointing towards those issues which won't lead to cancer but which could cause breast symptoms. So, yes, we do see a lot of abnormal mammograms, but most of them are not actually cancerous. But you're also true in saying that these days our mammo machines, especially the one we use in Apollo Jubilee that I know of, is an extremely wonderful high resolution machine where we are able to pick up 2 to 3 millimeter cancers. A 2
Mhm.
to 3 millimeters is smaller than the size of a rice grain, half the size of a rice grain. And we have picked up three really small 2 millimeter cancers in the last month alone, where we just removed the duct, not even a part of the breast, stage 0 breast cancer, and these people have been cured of cancer. So, yes, partly we are picking up non cancerous issues where we can reassure women that there is something wrong with the fatty tissue, but not a cancer causing problem. And two, our machines and our doctors have become such experts in the field that we're able to pick up stage 0 cancers as well.
That's wonderful. So what is your, you must be seeing a lot of people over the years. So do you think there are more women now who are open to or who are committed to, screening themselves? Or do you still think there is something holding many women back? Is it lack of awareness or lack of access, or is it some sort of a deeper hesitation that, what you see? I mean, like, when you get tested, something might come up, an old mindset that exists. What do you think? Because you are directly talking to so many patients, so many women, and how to be corrected.
Uh, I mean, if a woman has come all the way to Apollo Hyderabad, then obviously the
She's
uh,
not.
yeah, lack of awareness or lack of facilities is not the issue there. And one thing which really bothers me is women are biased towards certain organs. And why this happens, I'm not sure. The risk of cervical cancer and the risk of breast cancer are equivalent. We are almost saying 1 in 8 risk for both these diseases. I have a lot of women who are very willing and who are actually asking for mammograms even when they are not, when it's not time to reschedule it. Like, say, they have had one 8 months ago, and I would advise one in the next year and a half, but they're like, why can't you just do it? My neighbor recently had breast cancer. So I've come for a repeat mammogram. Or sometimes they hide the fact that they had one only very recently, worried that I might say, no, it's not time for a mammogram yet. But the
Just
same
to be
woman
sure.
hasn't had a pap for the last 5 years. She's well past her due for pap smear, but she won't have it.
Mm.
So this mindset I really can't understand, and I ask them, is it because you can't see your cervix but your breast is right in front of you that you're more worried about potential breast cancer but not cervical cancer? And they're like, no, no, it's not like that. But what is it that a woman would not want screening for pap test but is very keen to undergo repeated mammograms? And that is where I think women should realize that what you see and feel on the outside and what's hiding deeper inside your body are both equally important. But women are very biased towards breast. The chance of losing a breast is beyond uh, acceptable for many people, while many people are willing to lose their uterus, and they don't mind losing their uterus because they don't need it anymore. And I
Mhm.
think cancer is cancer, and wherever in the body you get cancer, I mean, it's going to set back your life in a way. So I think this bias in the way we approach different body parts should not be there. Well, when it comes to rural setting, obviously, one, it's lack of awareness, lack of education, lack of facility. But the pap smear has got this bad press about people going to your private parts. It's uncomfortable, it's painful. And when I tell people, like, look, if at all you get a cancer there, it's going to be far more painful. We are going to go into that part of the body multiple times, like maybe 25 to 30 times to give radiation or something. But it doesn't cross that barrier. It doesn't get into their system that one simple test which will take about 30 seconds might save me from a very big cancerous problem in future. Just that cultural thing, to go and lie down semi-naked and get something put inside your vagina is such a big thing for some people. So I think this is where we should also focus on self-testing for HPV. These women who so hate a pap smear might be willing to do a self HPV testing.
And also for that group of women, I mean, obviously the ones coming for a check or to see you to Apollo, they may not be the ones who are unaware, but there might be a whole cohort of people who might be watching this, who might not go for any screening at all, whether it's a mammogram or anything at all. So, what would your advice be to them? Because many times it's that old story of either I don't have time, I'll do it next month, child has exams, something. There's always something if you want to postpone it. And sometimes women do have multiple responsibilities, and this takes the last priority. So I would like to really request you to, address this group of women also who don't really seem to want to do any screening at all.
Yeah, the group who have access to healthcare, have the money to be able to get screened, but still don't, are either worried that they are good at the moment, they have no symptoms, and we might pick something up which will turn their life upside down.
Yes,
Okay.
exactly.
And this is exactly the group who is worried that, if something is picked up on the test, then that might interfere with her child's exams or schooling or whatever. But if the same woman gets diagnosed with a cancer in stage 2 or 3, that's going to upset their family life even more, far more than what a test abnormality might have upset them. So this is a wrong mindset, to postpone or delay finding out that there is something wrong with you will only worsen the situation. A stitch in time obviously saves nine, that saying didn't come for nothing. So any health problem, if found early, the treatment is going to be less intensive and the interference with your routine life is going to be less intensive. So how much ever you worry that the test might come abnormal, it is far better it comes abnormal at an early stage than the disease worsens to an advanced stage. Whatever disease or health problem is inside you, it's not going to just go away. Just because you delayed the test doesn't mean the problem will go away. You're only going to worsen your situation. And women do this, they're like, oh my God, if something turns up in my tests, then it's going to really upset my family life. It is this family who you're doing all this for. And what if you get a cancer and your family is going to be burdened by your cancer? Because not one single person gets cancer, the entire family gets the cancer. If I get cancer, it means that my family got cancer because whatever happens to me, it's going to reflect on my family. That is the
Yes,
role of a woman. We are the family, we run the family, we take care of the family. If something goes wrong with me, it will affect my entire family. So when I have brought children into this world and I don't take care of myself, then what am I doing to my children? How am I going to be a responsible mother if I can't take responsibility for my own health? So to
yes,
postpone a test or not to get a test which is required at your age, I think you're doing more harm to your family than good.
absolutely. So, as a last question, one quick decision that might change something in a woman's cancer journey, what would that be, Doctor?
That that will be the clarity you need. What test do you need at what age? This is just like your son's or daughter's school curriculum. What do you do in this month? You pay the fees, you get them ready for the exams and whatever. So have certain things or servicing your car. That date, that month won't change. Otherwise your insurance will be affected. So even you should think like that. I'm under 40, I need a pap smear every 3 years. I'm between 40 and 60, I need an ultrasound every year. I need a mammogram every 2 years. These things don't change. You have children, they need HPV vaccination. I'm more than 40, I need an ultrasound, CBP, a urine and a stool examination every year. This is mandatory. This is like you paying premium for your insurance. Nothing will change about it. These have to be done. On a sunny day, on a rainy day, you're feeling good, you're feeling sad, things are changing about your life. These things should not change. These are mandatory. And only when you do your basic stuff, when you do what you need to do, that you get this comfort in yourself. You sleep better, you sleep with peace that I have done what's what I can do. I have done everything that I should be doing. And that gives you a kind of confidence and boosts your immunity. Any woman who is postponing a test which needs doing, you're actually worrying about it, you're actually thinking about it, you're actually upset with yourself that you're not doing something you should be doing, and that reflects on your immune status. A woman with a low immunity is encouraging more diseases. So have a tick box, have a calendar where you say, and this month every year I'm supposed to be doing this. And all this will not cost you much. And most of the times when something is wrong on your test and you are asymptomatic, we can treat you in with much less interference to your lifestyle.
Absolutely. Yeah. And I think if you have this routine, as you say, of doing this test, year after year at the same time, it's unlikely that you will suddenly come up with a nasty surprise. I mean, you might just
Absolutely.
be tracking. So I think that's
Exactly.
another thing
Yeah.
which is encouraging. So thank you so much for this wonderful discussion. And viewers, I hope that you took these strong messages from Dr. To your heart. And I do hope that the message is clear. Cancer will not announce itself, it will leave early signs if we choose to look. So we have to look when it comes to cancer. Timing can change everything. So you can learn more about data related to not only cancer, but about all aspects of your health, about how early detection has impacted outcomes, can impact outcomes, how monitoring and follow up is important. So, do download our Health of the Nation 2026 report. And if you're on Instagram, the link is in the bio. It's there in our website, apollohospitals.com. And in YouTube, the link is in the description. You can click it and read the report because it's about people like you. It's real data. It's about real consequences, real findings, and it will help you to safeguard your health. Thank you and namaste.